Okay, so you know how sometimes your dog, who's usually like full of beans, is
Yeah.
suddenly just not, maybe sticking closer to the couch?
Yeah, or maybe you notice a little cough that hangs around longer than it should after a walk.
Exactly. Or maybe you get that call after a vet checkup and they mention something like a heart murmur.
hmm Those can all be little whispers about something potentially going on. And today we're diving into canine hypertrophic cardiomyopathy, HCM for short.
Right, HCM. Now you hear about that a lot with cats, but it definitely shows up in dogs too.
It does. And really simply put, HCM in dogs means the main pumping part of the heart, the left ventricle, it just gets thicker than normal.
Like, imagine trying to squeeze water through a pipe that's suddenly gotten narrower on the inside.
That's a great way to think about it. The muscle wall thickens inwards, leaving less space, making it harder for blood to flow efficiently.
Okay. It sounds a bit serious, and I guess it can be, but our plan today is to really, unpack this. What does it actually mean for your dog? What signs should you maybe look out for? And how do vets figure it all out?
Yeah, we want to make all this vet speak about hearts a little less intimidating.
Definitely. So let's get specific. This thickening of the left ventricle, you said it's a primary issue. What does that mean exactly?
Right. So primary means the problem starts in the heart muscle itself. It's not caused by something else going wrong elsewhere in the body that then affects the heart.
Ah, okay.
Now, other things can make the heart muscle thicken secondarily, like high blood pressure, but with primary HEM, the issue originates right there in the heart tissue. That's our focus today.
Got it. So the muscle itself gets thick. How does that actually mess things up for the heart doing its job?
Well, think about it. A thicker muscle is often a stiffer muscle. It doesn't relax as well between beats.
Okay, so it can't fill up properly.
Exactly. If it can't relax and stretch to fill with blood effectively, the pressure inside the heart starts to build up.
And that pressure has to go somewhere, right?
Precisely. It can cause blood, or rather fluid, to back up. Often, it backs up into the lungs.
Which leads to that coughing or trouble breathing we mentioned earlier.
It's often how it presents, yeah. That fluid buildup is what we call congestive heart failure, a potential consequence of HCM.
Now, you mentioned cats earlier. Is HCM in dogs pretty much the same thing we see in cats, just, in a dog?
That's a good question. They share the name and the core feature, that thickened left ventricle wall. But there can be differences.
Like what?
Well, for example, in cats with HCM, it's quite common to see enlargement of these little structures inside the heart called papillary muscles. We don't necessarily see that as consistently in dogs.
Huh. Interesting.
Yeah, so while the basic problem is similar, the finer details can vary between species, and that matters for diagnosis and sometimes treatment.
Okay, so why does this happen? What actually causes the heart muscle to thicken up like that in dogs?
That's the million-dollar question, really. And honestly, in a lot of dog cases, we just don't know the exact cause. We often label it idiopathic.
Idiopathic, meaning mystery cause.
Pretty much, yeah. It just seems to develop spontaneously.
Yeah.
But there's a strong suspicion that genetics are involved.
Ah, so it might run in families, so to speak?
We think so. Yeah. HCM is known to be hereditary in cats and humans. And while specific genes haven't been nailed down for most dog breeds yet, it seems likely there's an inherited component making some dogs more prone.
So it could just be in their DNA.
Possibly, yes. And just to quickly circle back, vets will also rule out those secondary causes we mentioned.
Like the high blood pressure.
Right, or certain hormonal issues.
Yeah.
You want to make sure those aren't the culprits causing the thickening before you land on a primary HCM diagnosis.
Makes sense. There's also something you mentioned, pseudohypertrophy.
Ah, yes. That's basically when severe dehydration can make the heart chamber look smaller and the walls seem thicker on an ultrasound just temporarily.
So it looks like HCM, but isn't really.
Exactly.
Yeah.
It highlights why context is important. You need the full picture, not just one snapshot, especially if the dog might be dehydrated.
Okay, interesting nuance there. So if genetics might play a role, are there specific dog breeds we see this in more often?
Yeah, there does seem to be some breed predisposition, although HCM can technically occur in any breed.
Okay.
Research has pointed towards some smaller breeds potentially being more affected. Think Schnauzers, various Terriers.
Like Boston Terriers.
Boston Terriers, yes, they've come up. And possibly German Shepherds too, though maybe less commonly associated with smaller breeds. It's a bit different from maybe earlier thoughts that focus more on large breeds.
So mostly smaller dogs, maybe some German Shepherds. What about age? Or, boy dogs versus girl dogs?
It's pretty variable with age. We see HCM diagnosed in fairly young dogs sometimes, but also in much older ones, so quite a wide range.
And sex.
Doesn't seem to be a strong link there in dogs. Some older studies might have hinted at males being more prone, but more recent data doesn't really back that up consistently.
So the big takeaway here is don't assume your dog can't get HCM just because they aren't, say, a Shih Tzu.
Absolutely not. Any dog, any breed, any mix. It's something to be aware of across the board. Vigilance is key.
Okay, so let's talk about spotting it. You said it can be sneaky early on. What are those first subtle signs?
Yeah, the early stage, what we call subclinical, means the dog has the condition but isn't showing outward signs. Often, the very first clue comes during a routine vet visit.
The heart murmur again.
Exactly. Your vet listens with the stethoscope, hears that little whoosh or murmur sound, and that might be the trigger to investigate further. Might be nothing, but it could be the first sign of HCM.
So that regular checkup is super important, even if your dog seems fine.
Crucial. Then, as the condition potentially progresses, you might start noticing things at home.
Like what kind of things?
Exercise intolerance is a big one.
Yeah.
Your dog just seems to tire out way more easily on walks they used to handle fine.
Or less interested in playing fetch for as long.
Right. Or just generally lower energy levels, more sleeping, less enthusiasm.
Okay.
That cough we mentioned can appear or worsen, especially if that fluid starts backing up into the lungs. Difficulty breathing, or maybe panting heavily even when resting. Those are definite red flags.
Yeah, they sound more serious.
They are. And sometimes it's easy to just think, oh, they're just getting older. But these changes, even subtle ones, warrant a vet check.
Are there other signs too?
Yes, sometimes you might see fainting or collapsing episodes. That's called syncope. Less commonly, maybe a swollen belly, if fluid builds up there, or even weight loss, or their paws feeling cold.
And this is tough, but sudden death is a possibility too.
Unfortunately, yes. In some cases, tragically, sudden death can occur, sometimes without many prior warning signs, particularly in dogs that have had fainting spells. It really underscores the seriousness of the condition.
Wow, okay. So if you notice these signs or your vet hears a murmur and HCM is suspected, what happens next? How do they actually diagnose it?
Well, it starts with that physical exam, listening carefully to the heart for murmurs, and also for any irregular heartbeats, which we call arrhythmias.
Okay, the listening part, then what?
Then comes the key diagnostic tool, the echocardiogram.
That's the ultrasound of the heart, right?
Exactly. It lets the vet actually see the heart muscle, measure how thick it is, see how well the chambers are squeezing, and check the heart valves.
So they can see the thickening directly.
Yes. And they look for other things too, like if the heart chambers are enlarged, or if there's something called SAM, systolic anterior motion of the mitral valve, which can sometimes happen with HCM and make things worse.
Sam, sounds complicated.
It just means one of the heart valves isn't behaving quite right because of the changes in the heart shape, potentially blocking blood flow a bit. The echo lets us see all that detail.
Okay, so the echo is king here. What else might they do?
An ECG, or electrocardiogram, is often done too. That traces the heart's electrical activity.
To look for those arrhythmias you mentioned.
Precisely. Irregular rhythms can be common with HCM, and the ECG helps identify what kind they are and how serious they might be. Sometimes, if the vet suspects the arrhythmias are only happening now and then, they might suggest a Holter monitor.
That's like a portable ECG the dog wears for a day.
Exactly. It records the heart rhythm over 24 hours to catch those intermittent problems. We also usually take chest x-rays.
What's the x-rays show?
They help assess the overall size and shape of the heart silhouette, and crucially, they show if there's fluid in the lungs, that sign of heart failure.
Okay, pictures from the outside and the inside. What about blood tests?
Blood tests can be really useful. There's one called ProBNP.
ProBNP, what does that tell you?
It's a hormone the heart muscle releases when it's under stress or stretch. So high levels can suggest the heart is working too hard, sometimes even before major changes are visible on the echo.
Like an early warning signal?
Kinda, yeah. And blood pressure measurement is vital too, to rule out hypertension as the cause.
Right, checking for those secondary causes.
Exactly. And in some specific cases, maybe tests for things like L-carnitine or taurine deficiency, though that's more linked to a different heart condition, dilated cardiomyopathy, but it might be considered.
Wow, okay, so it's quite a thorough workup, lots of pieces to the puzzle.
It really is. You need to put all that information together for an accurate diagnosis.
So let's say the diagnosis is confirmed. It's HCM. What happens then? Can it be treated?
That's the crucial next step. And the good news is, while we don't have a cure for HCM currently, it can often be managed. especially if we catch it early.
Managed. Okay. So what are the goals of that management?
The main aims are, 1, to control any symptoms of heart failure if they're present, like the breathing issues; 2, to help the heart function as well as it can despite the thickening; and 3, to try and prevent complications, like blood clots or sudden death.
Right. Keeping the dog feeling as good as possible for as long as possible.
That's the goal, and we use medications to help achieve that.
What kind of medication?
It depends on the individual dog's situation, but common ones include diuretics. They help get rid of excess fluid, easing congestion.
Like water pills.
Essentially, yes.
Yeah.
Then there are drugs called inodilators, which can help the heart muscle contract a bit more effectively. ACE inhibitors are often used. They help relax blood vessels, making it easier for the heart to pump.
Okay.
Beta blockers might be used, sometimes to help control heart rate, or if there's that SAM issue causing obstruction. Antiarrhythmic drugs if there are significant heart rhythm problems.
To keep the beat steady.
Exactly. And sometimes, blood thinners might be considered to reduce the risk of blood clots forming, which can be a complication.
That sounds like quite a cocktail, potentially. What about supplements? You mentioned L-carnitine earlier, or maybe fish oil?
Yeah, things like L-carnitine, taurine, omega-3 fatty acids. They might have some supportive role in some dogs with heart disease, but it's really, really important not to just start giving supplements. Because they aren't a replacement for proven medications, the evidence for their benefit specifically in canine HCM isn't always strong, and you need the right dose. Always, always talk to your vet before adding any supplements.
Okay, vet guidance is key there. So with management, what's the outlook? What's a prognosis typically like?
It's quite variable, honestly. Some dogs with early diagnosis and consistent medication can live comfortably for a good long time.
That's encouraging.
It is. But in other dogs, the disease can progress more quickly, unfortunately. Prognosis really depends on how advanced the disease is at diagnosis, how the dog responds to treatment, and whether complications develop. Early detection generally leads to a better chance of successful long-term management.
And you mentioned something about a specific type, HOCM?
Ah, yes. Hypertrophic obstructive cardiomyopathy. That's where there's a significant obstruction to blood flow leaving the heart, often related to that SAM issue we talked about. Interestingly, in some young dogs with HOCM, there have been reports where the obstruction actually seems to lessen or resolve over time.
Oh, really? So it can sometimes get better on its own in specific cases?
In some very specific instances, particularly in young dogs, that's something that has been observed, but it's definitely not the typical course for most HCM cases.
Still a little bit of hope there. So wrapping things up a bit, what are the absolute key things you want listeners to take away from our chat today about canine HCM?
I think number 1 is the critical importance of regular vet checkups. That murmur might be the first and only clue for a while. Early detection is everything.
Especially for those potentially predisposed breeds we mentioned.
Yes, definitely. And for some of those breeds, screening programs exist using tools like echocardiograms or Holter monitors to try and catch HCM even before symptoms start. That's worth discussing with your vet if you have a higher risk breed.
Good point. Anything else?
Maybe just a practical thought diagnosis and long-term management can involve costs. Thinking about things like pet insurance ahead of time might be helpful for some owners, just to be prepared for unexpected health issues.
That's a very real consideration. Okay, so to quickly recap, HCM in dogs is thickened heart muscle. Signs can be subtle early on, or more obvious later, like coughing or tiring easily. Diagnosis needs vet expertise and tools like echo. No cure, but often manageable with meds.
You got it. And hopefully this overview has helped make this complex topic a bit more understandable.
Absolutely. And this brings us to the most crucial reminder of all.
Yes.
If anything we've talked about today sounds familiar, if you have any worries about your dog's energy levels, breathing, coughing, or general heart health, please make that call to your veterinarian.
Couldn't agree more. This information is purely educational. It's not a substitute for professional veterinary advice.
Your vet knows your dog and is the only one who can properly diagnose or treat them. They're your partner in keeping that furry heart beating strong and healthy.